Getting a prescription used to mean a trip to the pharmacy counter. Increasingly, it means a few taps on your phone and a package at your door. A wave of digital pharmacies and direct-to-consumer health companies is rewiring how medicine is prescribed, bought, and delivered, sometimes cutting out the traditional middlemen entirely, including, in some cases, your own doctor's office. From Amazon Pharmacy to drug makers selling straight to patients, this is one of the most disruptive shifts in healthcare. Let's understand it, the genuine convenience, and the real trade-offs. So what's actually changing? Two connected things. The first is the digital pharmacy. Instead of standing in line at a counter, you fill and refill your prescriptions entirely online, and the medication ships to your door. Amazon Pharmacy is the giant example, bringing its logistics muscle and price transparency to prescriptions, but there are many others. Often these services show you the actual price up front and hunt for discounts automatically, a welcome change from the opaque pricing most people are used to. The second, more radical shift is the direct-to-consumer health platform. These bundle the whole journey into one smooth online experience. You describe your issue, have a virtual consultation with a clinician on their platform, get the prescription, and receive the medication by mail, all from one company, often in a day. Companies like Hims and Ro built their whole model on this, starting with things like hair loss and erectile dysfunction, and expanding rapidly from there. Here's where it gets really striking. Even the pharmaceutical manufacturers themselves are now selling directly to patients, cutting out layers of the traditional system. The clearest example is Eli Lilly's platform, Lilly Direct, which connects patients to telehealth providers and ships certain Lilly medicines straight to their door, including, notably, their blockbuster weight loss drugs. Think about what that means. The company that makes the drug now has a direct digital relationship with the person taking it. And the rocket fuel behind much of this has been the explosion in demand for the GLP-1 weight loss medications we've covered before. That demand was so enormous, and so many people wanted a discreet, convenient way to access these drugs, that it supercharged the entire direct-to-consumer model. We even saw this in a recent episode, where Lilly partnered with the Oura ring to wrap a wearable around a direct relationship. The pharmacy, the doctor, and the drug maker are all being reinvented at once. So how should we weigh this? The benefits are genuine and shouldn't be dismissed. Convenience is enormous. Medicine arriving at your door beats a pharmacy run, especially for ongoing prescriptions. There's privacy, which matters a lot for sensitive conditions people are embarrassed to discuss face-to-face. There's often better price transparency. And there's access for people the old system failed, those without a regular doctor, or who couldn't easily get an appointment. But now the serious caution. The core worry is the quality of that online consultation. When a company profits from selling you a product, there's an obvious tension. Does the quick virtual visit exist to genuinely assess whether the drug is right for you, or is it a formality that rubber stamps the sale you came for? At its worst, this model can encourage prescribing that isn't appropriate, and it can fragment your care, with medications coming from a platform that doesn't know your full history, your other drugs, or your real risks. Convenience and safety can pull in opposite directions here. So how do you navigate this new landscape sensibly? Digital pharmacies and direct-to-consumer services can be genuinely useful. The convenience and access are real, and for the right person and the right medication, they work well. But use them with your eyes open. The key principle is that these tools are best as part of coordinated care, not a replacement for a clinician who understands your whole health picture. A few practical guardrails. Make sure someone, ideally your regular doctor, has your complete, up-to-date list of medications, so nothing dangerous slips through the cracks between platforms. Be a little suspicious when a service makes getting a powerful drug feel too frictionless, too easy. Good medicine sometimes involves someone saying no, or not yet. And whenever possible, keep your primary care doctor in the loop, even about the things you order online. The system is being reinvented for convenience, and that's often a good thing, but your safety still depends on someone seeing the whole you. This is educational, not medical advice.